Good evening, Mike. So there's 12 so-called hotspot areas. There were some surprises because some of them seem like sort of rural areas, areas that don't have a lot of people. You wouldn't expect them to have a problem.
Yeah, absolutely, Sally. There's been a lot of focus on the metros, the city of Cape Town, Johannesburg, for instance, but quite a few smaller areas and even some district municipalities actually included in this list of hotspots. So let's take a quick look at some of the figures, Sally. We're going to focus on Gauteng to start with. The city of Joburg, of course, no surprise there, Sally. More than 1,342 cases as of the 24th of May. The city of Joburg making up just over 50% of all cases in Gauteng. So as we mentioned, government has said repeatedly that Joburg is a concern, as are the other metros. But this is interesting, Sally. Ekurhuleni, also identified as a hotspot. It has less than 600 cases, making up just over 20% of all infections in Gauteng. So you have to wonder, a lot of cynics will be saying, why are Ekurhuleni's numbers and Joburg's numbers being equated at the same kind of level? But we'll get into that in a moment. Tshwane, another interesting one, just under 370 infections in the country's capital, and that's 14% of all cases in the province. Let's focus very quickly on the Western Cape, Sally, and you'll get a sense of the differences between the major metro and the districts around it. Cape Town. More than 12,000 infections. Can you believe it? That's close to 90% of all cases in the Western Cape, Sally. And when you look at some of the other municipalities which have been identified as hotspots in the Western Cape, it really pales in comparison. The Cape Winelands, just over 700 cases, Sally, and that makes up around about 5% for the province. If we take a look at another municipality, which of course is the West Coast, just over 100 cases in that particular area, 106 for the West Coast District Municipality. That's less than 1% of infections in the entire Western Cape, Sally, and yet it has been identified as a hotspot. And finally, the Overberg, 75 cases in Overberg municipality, Sally, and that's round about 0.5% of the total number of cases in this particular province. So you're seeing the disparities there in terms of the city of Cape Town and a lot of the areas around it. And I suppose, you know, if you're sitting in some of these places, you might be saying, well, why are we hotspots when you take a look at the big metros? But, as I mentioned, there is a reason for this. Let's focus very quickly on our next graphic. And the President making this announcement yesterday, Sally, saying they're using this criteria. If you have more than 5 cases per 100,000 people, then you are in a danger zone. And if there's been a big spike in cases over the last week or so, you're in a danger zone. The key is not the raw numbers, Sally. It's really the capacity to deal with a spike in cases. So the mission really is to protect those local healthcare systems. It's not just about the data itself, it's about the context.
Right, so it's very much about understanding the ability to react. But then why are they looking at the numbers at all? I'm trying to understand the reasoning behind it.
Well, basically, they're worried about a spike, as I mentioned, which would put pressure on the healthcare systems as well. And, of course, they're looking at the numbers relative to the local population. So it's all very well to say that we've got fantastic hospitals in the city of Cape Town which can take care of all of these people. But perhaps if you're in the Overberg municipality, you can't get to a hospital in the city of Cape Town. You need a hospital in your own area. So those are the kinds of factors that need to be considered in terms of the pressure on the very local healthcare systems. Finally, Sally, let's quickly take a look at this map, which was issued by the presidency, came out around about 2 weeks ago. So these numbers would have been factored into the decision. Anywhere where you see a red patch, Sally, that's where you have more than 10 cases per 100,000 of the population. And interestingly enough, most of these red patches correspond with the hotspots that were identified. When you see a dark yellow as well, Sally, that's also flagged as a danger zone. So, for example, take a look at those municipalities around Cape Town, Port Elizabeth, Nelson Mandela Bay, Buffalo City, eThekwini and the Ilembe district, which is also identified as a hotspot, and then Johannesburg in dark yellow there, Sally, and Ekurhuleni in red. So those are all areas where you have a high amount of cases per 100,000 of the population.
So the one thing that orange patch in the middle, that I think is OR Tambo district. Chris Hani. And that is not very populated, but as you say, that might be because they're seeing numbers going up, and we know the Eastern Cape has been really tricky, and they might have very few resources. Is that perhaps the thinking behind declaring that a hotspot?
That could be the rationale, indeed. If it's not necessarily the cases per 100,000, part of the decision-making could be a rapid increase in the number of cases over a short amount of time. Again, it comes back to the logic of trying to protect the local healthcare system, so there isn't a massive influx of people over a short amount of time.
Yeah, and we've already seen a couple of hospitals in Cape Town are already full, and the ICUs are filling up. So, yeah, it is certainly a big consideration. We hope to get more details later this week, I understand, of what COVID level 3 actually means for the country. We've got the bare bones from the President, but more details this week.
Absolutely. We're expecting a briefing, I think, 4 o'clock tomorrow afternoon, Sally. So we hopefully will get some idea of how they're going to distinguish between some of the hotspots, as we've mentioned, and the rest of the country. But government stressing that all of these metros will also go down to lockdown 3. Their focus is really throwing resources, specialist teams, throwing more personnel into these areas to try to protect them as much as possible.
Thank you very much, Michael Marilia.